keep the flow going.
Thank you,
Yeah.
Dr. Mathur, for this inviting me to be a part of this Tele ophthalmology session, and which is close to my heart. Uh, Thank you, sir. I'm going to do the two talks, one on the vision centers of the primary care, and the other one of Dr. Rajiv Raman's talk. Unfortunately, is
Yeah.
not being,
Sure.
he has
You
been
can
called
continue
off
one
on.
after the other.
Yes, sir.
Yeah.
So, what is vision centers? You know that we have I don't need to tell the ophthalmologist the size of problems that we have in vision. But the problem is creating access to people in the remote areas, how to reach everyone who needs primary care or in eye care. In most developing countries, the proven treatments reach people, only 20% in the urban areas, but it hardly reaches the people in the primary or urban or rural settings. And if you strengthen the primary, the main problem that we are getting a lot of patients in the tertiary care is because of the failure at the primary care level. When we are not addressing it when it is small, if that can be done, then we can reduce the number of patients coming at the tertiary care level with advanced problems such as diabetic retinopathy, glaucoma, or corneal injuries. But how to reach these everyone early on? How do we create? I just wanted to show you that we used to go to eye camps, do screening, a lot of going into the community with a whole team. But we realized in the late 90s that we were not, in spite of the huge team going into the community, we were still not reaching everybody who need care. Only 7% of those with felt need care were being seen, and the rest were still not being addressed because you are going once in 3 months or 6 months into that community, and so you are not addressing really the entire problem. So that's why in 2003-4 we transited partly to the vision centers, creating what we call as primary eye care centers or vision centers. This is for every 50,000 population, we set up these vision centers. Today we have about 100 vision centers in the state of Tamil Nadu, where these vision centers are set up where there are no ophthalmologists in a small towns, where there's connected to the different villages. These are permanent facilities, eye care facilities, a small facility manned by one ophthalmic technician and a coordinator who would they would do a complete eye examination just like an ophthalmologist would do. And so the idea is to provide eye care, and they have connectivity to the base hospital. So it's like a hub and spoke model for every tertiary hospital that we have. We have multiple vision centers connected to them. They are like around 50 to 100 kilometers in radius or in the distance from where these patients are seen. So in a typical vision center, what happens is the patient gets registered, the ophthalmic technician would do a complete eye examination just like an ophthalmologist would do in a slit lamp, do an entire, the exact data is all examined and entered into an electronic medical records. So they would do an appellation tonometry, do a fundus photograph as needed. This earlier we were using these simple digital cameras, but today we are replacing it with the low-cost fundus cameras. And then they connect to the ophthalmologist in the base hospital, who would look at the electronic medical record simultaneously, any images uploaded, and then they talk to the patient directly to tell them whether they need to, what should be done. Either most often it's glasses or irritation, watering, those kind of things. Only 10% of any of these vision centers, we need to refer these patients to the base hospital for any further management. So it really makes a big difference for the people living in these remote areas. People who are not accessing care would access care in these patients. So we would create these patients, like, prescribe medicines there. The whole idea is to, even the glasses are dispensed there because the patient need not travel to a city for getting any of these services. Today, we are doing more than about, actually today it's about close to 3,000 patients every single day. We are doing these teleconsultations across those 100 vision centers. So what is given in this? It's identification of basic primary care, where we are able to identify whether the patient has got any refractive errors, whether the patient has got cataract, whether the patient has got glaucoma, diabetic retinopathy. These are screening. I'm telling you, this is screening, not the actual diagnosis. But then you are able to do the screening with these help of these ophthalmic technicians, and basically, especially this trauma for corneal ulcers and stuff, we have been able to reduce that. So today, this is considered the best last mile connectivity in any healthcare intervention, because today we are able to access, even in the remotest area, no dependence on the attenders for the patient, which normally when they have to come to a hospital, they have to bring an attender, and time and money saved. More importantly, compliance to care has improved because they are right there. They don't have to go into the city looking for spending the whole day, which means it's a loss of wages for the whole day, and also having to take somebody with them. So this is just to give you the numbers. We are also doing this diabetic retinopathy screening. I'll talk about this with, we are using artificial intelligence to help these vision center technicians. So today, this has become a model where the government of Tripura, this happened in 2007, when they established about 40 vision centers running even today successfully. The government of Tripura established it. We went and set up the whole thing. And this is being scaled in multiple states as we speak. Bangladesh is planning to establish about 400 vision centers. Today we have helped them to establish about 90 vision centers. So what it means is you're really creating access to primary care in these vision centers. There's another initiative by Rotary Club, which is creating these what we call as hybrid vision centers. They're using mobile vehicles and mobile vans to reach into the community, and also a central vision center. And these are all having linked to one of the tertiary hospitals. So what is enabling today this to happen is because of the nationwide broadband availability through the mobile networks and widespread of use of EMR. But we really, the new policies on telemedicine will help in improving this or creating access to care in the remote areas using teleophthalmology. So as I said, a good primary care system reduces the bulk of the load in the tertiary care. So the tertiary care people can focus on really addressing the serious problems that reach out to us. So, thank you.